Hello, so this is Chapter 33, Pharmacology Interventions for Substance Use Disorder. The theory behind pharmacotherapy of SUDs. Subgroups of pharmacological interventions. Medications that can control withdrawal symptoms, medications that control cravings for drugs, aversive agents that cause dysphoria when certain compounds are used, compounds used to treat concurrent psychiatric disorder, agonist compounds used in certain maintenance programs, medication used to treat drug overdose. So, pharmacological treatment of AUDs, 1 of 5. Pharmacological treatment of alcohol withdrawal syndrome. Benzodiazepine, a currently accepted treatment. Reduces the risk of rebound withdrawal symptoms, various approaches, fixed dosing regimen, loading dosage, symptom trigger regimen. Anticonvulsant medicine like carbamazepine and gabapentin are safe alternative. Sulfuramin. Aversive condition principles produce unpleasant effects, categories as a prodrug, but can have a toxic effect. Factors that influence alcohol dysphoria interaction. Length of time person has been taking the drug. Time since the last dose was ingested, amount of alcohol ingested, individual biochemistry. 20% of those prescribed this drug take it as prescribed. Naltrexone blocks the mu receptor in the brain, reduces the urge to drink, helps prevent a slip from becoming a full-blown relapse. A camprocyte appears to limit the release of glutamate during and after the period of withdrawal. Limited side effect profile, and no evidence of a rebound effect. Pharmacological treatment of AUDs. Other off-label medications include topiramate, baclofen, erypryl, nalmefene, buspar. It's called busparian. Metronin, diazepine, lithium, ondansetron. Selective serotonin re-up inhibitors, SSRIs. Varenicline is sold under name brand Chantix. Originally marketed as a smoking cessation, it has been found to be useful as an aid to alcohol cessation as well. Prednisone, antihypertensive agents, phenobarbital. So pharmacological treatment of stimulant use disorders. At this point, no known reliable pharmacological treatments for stimulus use disorders. So they have a couple listed here that can be used: bupropion, mirlaxapine, modafinil. I'm probably butchering these names. Pharmacological interventions for cocaine use disorders. At least 19 compounds have been considered for treating cocaine use disorder. None have been found effective. Experimental pharmacological interventions for cocaine use disorders. So clonidine, desipramide, bupropion. Experimental pharmacological can use include methadone, propranolol, stimulant replacement therapies. Pharmacological treatment for opioid use disorders, one of three. Medications to treat opioid overdose, Narcan, should only be used after the person is completely detoxified from narcotics, a part of comprehensive psychosocial treatment program. Compounds that treat opioid withdrawal, methadone, bupropion, and clonidine. Pharmacological treatment of opioid use disorders, 2 of 3. Experimental methods of opioid withdrawal, ultra-rapid opioid withdrawal, about as effective as traditional opioid detoxification. Opioid against agents to treat opioid use disorders, methadone. Some information about that underneath. You have some bupropion, chemical cousin of morphine, administered infrequently 3 times a week. Withdrawal is not as intense nor as long as methadone. Side effects: constipation, urinary retention, and sedation. So this is for the treatment for tobacco use disorders. Nicotine is the most addictive compound in cigarette smoke. Nicotine replacement systems: you have gum, patches, the nasal spray, electronic cigarettes, side-teen combination therapies. No non-nicotine replacements for smoking cessation. Bupropion, which is Wellbutrin, or virilizine, which is Chantix. Experimental compounds for smoking cessation: buspirone, clonidine. Immunological approaches: inverse, clozapine. So that's it for this one. Thanks for listening.